Bismillahirrahmanirrahim. Today we are going to learn about some important respiratory diseases. The most commonly occurring respiratory diseases are asthma, chronic obstructive pulmonary disease, that is also called COPD, chronic bronchitis, emphysema, tuberculosis, pneumonia, and pleural effusion. First of all, asthma. In the asthma, the airway become narrow, the airway become filled with mucus, and there are some shortness of breath in the symptom. There is also wheezing. In this diagram you can see this is a normal airway and this is an asthmatic airway. You can see over here that there is a thin layer of mucus over here, while over here in the asthmatic patient you can see that there is excessive mucus and also some lumps of mucus over here. You should be quite clear that in the asthma the smooth muscles which are all around the bronchioles become constricted, which lead to the narrowing of the airway, and there is also accumulation of mucus in the airway. So the accumulation of mucus and the constriction of the airway leads to the wheezing, leads to the shortness of breath, and leads to the difficulty in respiration. Though in the asthma you will never see any sort of microbe as a causative agent. There is no microbe which is responsible for the induction of asthma, which is responsible in the pathology of asthma. But asthma is normally caused by some environmental factor, some internal factor, some sort of allergen, and some other factors as well. The second one is emphysema. Emphysema is actually the destruction of walls of the terminal bronchioles and alveoli. In this, you can see in the diagram that this is an alveolar sac, and this is also an alveolar sac, but of normal individual, and this is alveolar sac of the patient having emphysema. You can see over here that the alveoli are damaged, but over here the alveoli are normal because this is a normal air sac and this is an air sac having emphysema. So there is destructions of the terminal bronchiole. The terminal bronchiole, these are the terminal bronchiole, and the terminal bronchiole also get destructed, and the alveoli also shows destruction, and the airway and this air sac shows some entrapped air, the air which cannot be expelled from this air sac. In the emphysema there is destruction of layer of the alveoli. When the layer of the alveoli get destructed, then the alveoli is unable to contract and relax normally, and it leads to the entrapment of some air, and this leads to the condition that is called emphysema. The third one is COPD, chronic obstructive pulmonary disease. In the chronic obstructive pulmonary disease, there is the word chronic. Chronic means gradual and progressive and irreversible exacerbation of the lung airflow. And the COPD, the airway become gradually destructed. The airway goes to destruction gradually. There is chronic destruction of the airway. In simple pathology, the bronchitis plus emphysema, combinedly is known as COPD. When there is emphysema as well as bronchitis, when there is emphysema, the emphysema which I have told you in the previous slide, when there is emphysema and bronchitis mean inflammation of bronchioles. Inflammation of bronchiole. So when there is inflammation of bronchiole and the destruction of the alveoli as well, So this condition is called COPD. So, in this condition, the patient is unable to exchange the gases. The patient is unable to ventilate properly, and this may lead to some sort of problem in the heart as well, because the heart do not receive that much of the oxygenated blood which is responsible for the normal functions of the body. So you should be quite clear about the COPD, that this in this disease the exacerbation take place. The exacerbation means that the condition become worsen as for the time goes. So with the passage of time, the condition become worse and worse in this condition and the COPD. So this is a progressive and gradual. This is very gradual, but this goes to exacerbation always. This do not goes toward improvement. This do not goes toward amelioration. The third one is pneumonia. Pneumonia is an infectious disease. Actually, this may be caused by bacteria, virus, fungi, but and in this condition, the alveoli become filled with the mucus, especially the alveoli. And you can also observe in this diagram over here, you can see that this is the right lung and this is the left lung. In the right lung, you can see some consolidated masses over here. These are consolidated masses. These consolidated masses represent some mucus-filled alveoli or mucus-filled alveolar sac. When the alveolar sac become filled with mucus, this get changed into the consolidated mass, and that consolidated mass, when seen in the X-ray or when observed in the bronchoscopy, that is what we call pneumonia. Pneumonia usually occur in the small kids because of the susceptibility of the kids to the pneumonia bacteria, especially the bacteria which is responsible for the induction of pneumonia. So in this condition, the patient is also unable. The patient is the breathing in the patient become very difficult. So in this diagram, you can also see that this side represent the normal airway, and this represent the patient having pneumonia. This represent the airway of the patient having pneumonia. So this is the terminal bronchiole, and this is the alveoli. In pneumonia, you will see that the alveoli become fully filled with the pus. With the pus, not with the mucus. This first of all, the mucus accumulate over here, and then the mucus turn into pus, and that when this get filled with the pus, this condition is called pneumonia. So this is mainly called, the major cause of this disease is bacteria. And this one represents the tuberculosis, and the tuberculosis is actually caused by Mycobacterium tuberculosis, and this is an infectious disease which affects the lungs and some other parts of the bodies as well. And tuberculosis, the cough lasts for more than 3 weeks, and there is loss of appetite and loss of weight also, and there is fever, chill, and night sweats as well. These are just the symptoms, but in the diagram you can see over here that when the tuberculosis bacteria, Mycobacterium tuberculosis bacteria, come over here in the alveoli, the macrophages get all around the tuberculosis bacteria, and when it get all around the tuberculosis bacteria, there is the perfusion over here become high. The perfusion of plasma become very high over here, and some dripping of the blood also comes over here in the alveoli. So one of the symptoms of the tuberculosis is also the production of bloody sputum. So because of the high perfusion of the airway due to accumulation of high amount of macrophages around the Mycobacterium tuberculosis. So this when the patient cough, he expel large amount of fluid, and that fluid you can also see in some patients that it will contain some sort of blood as well. So this is caused mainly by the Mycobacterium tuberculosis, and this is one of the major cause of death in some of the most advanced countries where there is a lot of smoking.